Good morning/afternoon, everyone. Today, we're going to explore a very important and complex topic: intimate partner homicide. This presentation will provide a comprehensive overview, helping us understand the risk factors involved, the experiences of both victims and perpetrators, and most importantly, effective strategies for intervention and policy responses. Our goal is to deepen awareness and work towards preventing these tragic outcomes. Let's dive in. Intimate partner homicide, or IPH, refers to the killing of a current or former intimate partner. This can include spouses, dating partners, or people who live together in a romantic relationship. It's important to understand that IPH is one of the most extreme consequences of domestic violence. Because of the serious harm it causes, it's recognized globally as a critical issue for both public health and safety. Addressing IPH is essential for protecting individuals and communities alike. Each year in the United States, there are roughly 1,800 intimate partner homicides. This is a significant number that highlights the severity of the issue. What's particularly alarming is that women make up about 75 to 80% of these victims, showing that intimate partner violence disproportionately affects women. Looking at the global picture, intimate partner homicide stands as a leading cause of death for women of reproductive age. This really underscores how widespread and serious this problem is, not just here, but worldwide. When we talk about the victims of intimate partner homicide, the majority are women, especially those who are in their reproductive years. This group faces the highest risk, which is an important point to understand. Additionally, certain factors make individuals even more vulnerable. For instance, people who have experienced previous abuse or who live in environments with high levels of stress are at greater risk. These conditions can escalate the chances of violence becoming fatal in intimate relationships. So, recognizing these vulnerability factors is crucial in addressing and preventing these tragic outcomes. When we look at who the perpetrators are, there are several key factors to understand. First, most perpetrators are current or former intimate partners of the victim. This means that violence often occurs within a close personal relationship, which adds a complex and painful layer to the situation. Next, many offenders have a documented history of domestic violence, indicating a pattern of abusive behavior over time. Additionally, substance abuse issues are frequently present among perpetrators, which can exacerbate violent tendencies. Finally, controlling and coercive behavior within the relationship is a critical factor. These patterns of control create an environment where the risk of homicide significantly increases. Understanding these characteristics helps us identify and address the root causes more effectively. When we look at the risk factors behind intimate partner homicide, there are several key elements to consider. First, previous incidents of domestic violence greatly increase the likelihood that the situation may escalate to homicide. Past violent behavior is a strong indicator of future danger. Another critical factor is the availability and access to firearms. When firearms are present and easily accessible, the risk of lethal outcomes rises sharply. Economic stress or hardship also plays a significant role, as financial strain can exacerbate tensions and conflict within relationships. Intense jealousy is another important contributor. It can fuel dangerous emotions and actions that put the victim at greater risk. Lastly, controlling behaviors by the perpetrator, such as extreme possessiveness or isolation tactics, significantly elevate the risk of intimate partner homicide. Understanding these risk factors helps us identify and intervene before it's too late. Firearms significantly raise the risk of fatal outcomes in cases of intimate partner violence. When a firearm is present, conflicts that might otherwise result in injury or non-lethal harm can quickly escalate to homicide. This increased lethality underscores the importance of understanding how access to these weapons influences domestic violence dynamics. Research shows that enforcing stricter regulations on firearm access for individuals identified as at risk of committing domestic violence can lead to a noticeable reduction in intimate partner homicides. This evidence highlights just how crucial firearm regulation is as part of broader prevention strategies aimed at protecting vulnerable individuals and saving lives. Social isolation plays a major role in increasing the risk of intimate partner homicide because it cuts victims off from potential help and support. Poverty also significantly adds to vulnerability, as financial struggles can trap individuals in abusive relationships due to lack of resources to leave. Substance abuse further complicates these situations by intensifying stress and aggressive behaviors, making the environment even more dangerous. Additionally, when victims don't have strong social support networks, it becomes much harder for them to find the safety and assistance needed to escape harmful circumstances. All these social and economic factors together create a challenging landscape for those at risk. Before intimate partner homicide occurs, there are often clear warning signs, such as threats of harm, stalking behaviors, and an increase in violence. Recognizing these signs is absolutely critical because it creates a chance for early intervention. By identifying these indicators early, we have the opportunity to step in and potentially prevent a tragic, fatal outcome. The key takeaway here is that timely recognition and response can save lives. Intimate partner homicide leaves a deep and lasting impact not just on the immediate family, but on the wider community as well. The trauma and grief experienced are profound, affecting people on a very personal level. Beyond the emotional pain, there are significant economic consequences too. Families often face financial hardship due to lost income or the added costs that come with such tragedies. Additionally, these events disrupt social networks, reaching far beyond the victim's close circle and affecting the broader support systems that many rely on. This ripple effect highlights just how widespread and far-reaching the impact truly is. When it comes to preventing intimate partner violence, several key strategies play a crucial role. First, early intervention programs are essential. These programs aim to identify and address warning signs before the situation escalates, which can significantly reduce the risk of violence. Next, legal protections like restraining orders provide an important layer of safety for victims, helping keep perpetrators at a distance and prevent further harm. Community education is another vital component. By raising awareness about the risks of intimate partner homicide and how to recognize warning signs, we empower people to act early and support those in danger. Finally, outreach initiatives offer direct support to individuals who may be at risk, connecting them with resources and services designed to reduce violence and promote safety. Together, these strategies form a comprehensive approach to prevention. When we look at legal and policy responses to address intimate partner homicides, there are three key measures to consider. First, restraining orders serve as an important tool. They legally prevent abusers from contacting or approaching their victims, which can significantly reduce the risk of further violence. Next, firearm restrictions targeted at high-risk individuals are crucial. By limiting access to guns for those who pose a danger, we enhance overall safety and reduce the likelihood of fatal outcomes. Finally, strong prosecution of offenders is essential. Holding perpetrators accountable sends a clear message that such violence will not be tolerated, which helps deter future offenses and protects potential victims. Together, these strategies form a comprehensive legal framework to combat intimate partner violence. When we talk about community and support interventions, one of the main priorities is ensuring access to safe shelters. These shelters provide a secure environment where victims can find immediate safety and support. Another crucial component is counseling services, which offer emotional and psychological help to those affected, helping them process their experiences and begin healing. Additionally, coordinated efforts among law enforcement, social workers, and healthcare providers are essential. By working together, these professionals create a strong network that not only protects victims, but also supports their recovery and long-term well-being. This collaborative approach is key to making a real difference in people's lives. One major challenge we face is the underreporting of abuse. Many victims don't come forward because they're afraid or feel stigmatized. This silence makes it much harder to intervene early and prevent escalation. Another key issue involves barriers that limit the safety of victims and their ability to access necessary resources. Without safe options and support, victims remain vulnerable. Finally, we often see insufficient funding and a lack of comprehensive support services. This gap means prevention efforts and responses aren't as effective as they could be, leaving critical needs unmet. Addressing these challenges is essential for making real progress. When we look at intimate partner homicide, it's clear that this is a preventable tragedy. By coordinating legal frameworks, social support, and community efforts effectively, we can make a real difference. Awareness plays a crucial role. When more people understand the signs and dangers, intervention programs become far more effective in protecting lives. Lastly, strengthening protective policies is essential. Stronger laws and regulations create safer environments and reduce the overall impact of this serious issue. Together, these steps form a comprehensive approach to preventing these tragedies and saving lives.